perimenopause specialty is not for losers. We can either get really good weeks or really bad weeks, kind of like anything in healthcare. And this week was particularly emotionally draining and just heavy on the heart. Here are some of the most challenging cases that I had this week. Well, first off, we had multiple cancer diagnoses, and I don't love it. It's really not what brings me joy. Luckily, I rarely diagnose cancer. It's pretty few and far between, but to get in with an OBGYN here, if you don't already have one, can take a while. And when you get a cancer diagnosis or you need a biopsy to confirm cancer, so we had another one of those where it's looking like cancer on an MRI and ultrasound, but we need a biopsy. Tip on this, anytime you move somewhere, get a primary care, get an OBGYN so that when you need one, you have one and you can get in a lot sooner. We also had some suicidal ideation with an ER visit this week. Bringing me back to my psych days, not that I don't deal with psych all day, every day in this job as well. Perimenopause is the highest risk of suicide for women. So this is something that we do run into. If you have someone in perimenopause that are having depression and anxiety, just know that we gotta look over those people and make sure that they're okay more often than maybe we would before, especially if there's any pre-existing depression or you name it. These people need to make sure that they're monitored even more closely in perimenopause so that we can make sure that we get on it so they get an ER visit, not the alternative. And if that wasn't enough for you or for me, I had a patient confide in me about their grape trauma that is pretty horrific, for a lack of a better term. Horrific. I'm always so thankful and appreciative when my patients trust me enough to tell me the worst thing that has ever happened in their life and trust in me to give them guidance and honestly just to listen and not re-traumatize them. Anyone who's working with women, honestly, I think should be trained in trauma-informed care. I was trained in that while I was a psychiatric nurse, and I think it's been one of the most valuable tools that I've had in my nursing and nurse practitioner career in general. But let me tell you, it never gets easier hearing about that. It never gets easier. I don't know what's in retrograde, but if that could not happen next week, that would be sick.